The following podcast is provided by Athira Pharma and Answers for Elders Radio.
And welcome back, everyone, to Answers for Elders Radio Network. And we are here again with Dr. Verghese, and he and I have been talking about Alzheimer's disease. And certainly Alzheimer's disease, as if you've been listening with us this hour, pretty amazing statistics that are going on out there. And specifically, Dr. Verghese, I want to welcome you back to the show. And in our last segment, I really want to talk about getting people the tools to be able to reach out and get, participate in a trial. I know that it's hard for people to ask for help. And it's a lot of it is denial. It's like, I don't want to acknowledge the fact that I'm having these symptoms. I don't want to, bother my family, all of those little things that, they're pride factors, all of those things. Tell me a little bit, Dr. Verghese, how are those things manifesting in people to refuse trials? I guess that's my question.
Yes. And for this, you have to understand, I'm a specialist in psychiatry and neurology. Mm-hmm. If it's something like cancer, people, or heart disease, people say, my body is failing me.
Yeah.
It comes to your mind or your brain, people think, I am failing.
Yeah.
They take it as a personal thing, but yet our mind sits in the brain.
Yeah.
Brain and mind are kind of a fused entity.
They are. Yeah.
These are illnesses, just like cancer, just like HIV, just like COVID. Mm-hmm. And saying it ain't so doesn't change it. If you have the illness, you have it. Now, in the old days, I can understand that, there was, as I called, a sense of learned helplessness that you can't do anything about it, so why bother? But that's not the case anymore. And it's not just the so-called patients, it's also the children and the spouses and the neighbors and the friends. And we all need to be aware of this. When I teach, I say, everybody knows the symptoms of a heart attack, right? Chest pain, sweating, collapsing. Everyone knows the symptoms of a stroke. Your face starts to droop. Everyone knows if you have a lump in your breast or you're pooing blood or you're peeing out blood, that could mean cancer. Not many people know the symptoms of Alzheimer's disease.
True.
Especially the early symptoms. So
I like what you're saying. If some people think, oh, well, it's just, it's Alzheimer's disease, ha, 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 I forgot, or anything like that. Those are like, and yes, there's an element of that's normal, that, like you just said. Do you remember what you wore last Tuesday? Those are details. And I think it's your own abilities too. It's like, I know I'm not a detail person. I get it. I am totally a visionary. And I have to concentrate on, did I remember to, pay the electric bill this month? It's just, these are details that I don't do well with. But you know what? I married the detail master, right? So understanding that we all have strengths. And I know we're not talking about everyday things. We're talking about situations where maybe a loved one, you're a spouse, and all of a sudden, your wife, you're a husband, and you're looking at your wife and saying, she is displaying some of these early symptoms.
Not as sharp as she used to be. And one of the first and most important symptoms is the subjective feeling that my brain is not what it used to be. It takes more effort. It's harder for me to do things that I could do easily. And especially if it seems to be going down. The senior moment is kind of at a plateau, but if this is getting worse and it's harder and harder for you to do things, if you forget mundane everyday things, you're asking the same question, even though it was told to you before. If you need to use your cell phone or post-it notes, here's the one, especially in pandemic times and when we're all binge watching. If you find it difficult to follow the plot of a serial,
good
a movie,
one,
because that's all short-term new learning.
Yeah.
So the spouse will say, who's that person? Why are they doing this? Or, you see the same movie again and you don't realize that you have watched it. So these are all symptoms of early Alzheimer's disease. And what I would suggest to people is look for a clinical trial near you. There's a government website called Clinicaltrials.gov.
Okay.
And you can go to www.clinicaltrials.gov, look for trials that are going on in your neighborhood.
Yeah.
Unfortunately, there aren't trial centers across the country. They're mainly focused in the bigger cities. And, it's usual to say, go to your doctor, but often doctors are also not as clued into what is going on. And part of my job here in Philadelphia from Keystone Clinical Studies is to educate both the professional community and the general public. So
Absolutely.
and thank you, Suzanne, for doing this, because this is part of that educational process to get the message out.
It is. I know I have several people that, one of the things that I love is, I know a friend of mine, he used to take his dad to lunch every Tuesday. They would have a standing date once every Tuesday because it was routine, right? And dad always, they had a father-son day once a week, which I thought was really amazing. Well, all of a sudden, dad had a hard time ordering from the menu. That was the clue. When he was used to going out to lunch every week, they went to the same restaurant, but he couldn't even, he was now having a hard time trying to figure out what he wanted to eat and how to order it. And I thought that was kind of interesting. And he goes, the first time I didn't think too much about it, but it kept getting worse. And he goes, that was the key that I realized that we needed to get help. So those are little things too. I'm sure that's a part of it as well.
Right. And we all need to look out for each other. I mean, if you're traveling or you're going somewhere, they'll ask you, do you have all these symptoms of COVID? We've been doing that in the last 2 years. We've been sensitized to looking out for these symptoms.
Yeah.
And we all wear a mask when we're going out. I think we need to take this to the next level to look at Alzheimer's, which is an epidemic that is going to make all this look like a walk in the park, because it's a slow burn, long-term problem. Well, and we need to educate ourselves and look out, as you said, watch out for these symptoms.
Yeah. And we have to look at a crystal ball coming up. I mean, the fact of the matter being is, like what you said, it's the inverted triangle. It's, we're going to have so many people needing care with so many little amount of people to help, unless we step in and start making some bold choices. And that means that, all of us, I think, have a responsibility. If we have a loved one, not only are you giving them an opportunity to have treatment that is probably going to do far better than what's out there already. They're going to get the finest in medical care of people that know and specialize in a disease, that know more about, the disease that they're suffering with was Alzheimer's disease than any regular doctor would even begin to know. And that's the thing I think that, really is important, that by participating in these types of trials, you're getting the very, very best that's out there, and you're getting the highest level of, medical professionals that are there to work with you. And I know that, that's the great thing about working with a trial, because the doctors that work these trials, they're the finest, they're the cream of the crop.
Very experienced doctors. And
yeah. So Dr. Verghese, and I know we only have about 4 minutes left, but I want to learn a little bit about your specific research clinic institute and where you are in Philadelphia.
So let me just step back. When we talk about treatments, I just want to say that there is no single magic bullet.
No.
Let's think about, say, diabetes. How many classes of medicines there are? There are oral medicines, there's injectable medicines, there's long-acting medicines. HIV, we were able to really get on top of HIV with the triple medication regimen. Heart disease, asthma, all of these illnesses require different approaches, medicines that work through different mechanisms to get at that disease. So similarly, Alzheimer's is as complicated, if not more complicated, than these illnesses. So we are looking at medicines that hit it from different approaches for different stages of the disease. And that's where the field is at, and that's what we do at our site here, Keystone Clinical Studies. We have 1, maybe 2 studies for prevention of Alzheimer's, studies for the early stages of mild cognitive impairment, And the Athera study is a very important part of people who already have some amount of Alzheimer's dementia.
Mm-hmm.
And there are medicines that are hitting the amyloid in terms of mechanisms, medicines that are hitting the tau tangles. There are medicines like this that are for neuro regeneration to help the brain rewire itself. We're doing a Parkinson's disease study with fosgonimeton.
Yes.
I hope I got it right. So we are hitting this illness from different approaches, different mechanisms of action at different stages. And that's really what we need overall. And I'm sure that this is going to be a very important part of the toolkit of doctors.
Right. Well, I'm very excited about a program that we've got put together, and certainly we want to encourage each and every one of you that are listening. If you know of someone, no matter what stage they are with Alzheimer's, there probably is something available for you. And certainly, Dr. Verghese, it's been such a pleasure for you to be on the program with us today. And I am going to give again a website out to everyone. If you're interested or just want more information, please go to www.lift, that's LIFT -AD, which stands for Alzheimer's disease.com. There is a website, give you all the information. And also, how do we reach your clinic if you're in the greater Philly area?
It's very easy. Just Google Keystone Clinical Studies.com or call our office, which is 610-277-8073, 610-277-8073, KeystoneClinicalStudies.com.
And again, we want to hear your stories. We want to hear about your successes and what you're going on. So you can find us always on Google, Spotify, Apple, and more. And Dr. Verghese, thank you again for being with us this hour. It's been a real pleasure to have you.
Thank you. Thank you, Suzanne, for what you're doing. And thanks to Athera for spreading the word too.
Absolutely. And for each and every one of you this week, please reach out to a loved one. Please think about the people that you could help make a difference in their life, and always be good to each other.
The preceding podcast was provided by Athera Pharma and Answers for Elders Radio. For more information about the Alzheimer's clinical trial, go to atheraclinicaltrials.gov.